Asian Hospital has opened the Philippines' first hernia center to address gaps in surgical care, expand access, and centralize specialized treatment. Dr. Beaver Tabesis and Dr. Carlos Ejercito of Asian Hospital and Medical Center discuss its significance. Glad you could both join us today, Dr. Beaver and Dr. Carlos. Let me start with this. What demand, backlog, or revenue trend supported the case for a dedicated center?
Thank you very much for the question and for the invitation to join you. Clearly, as the population ages, the incidence of hernias actually increases. And we are starting to see a lot more of these. Up to about 1 out of 5 individuals can actually come in with a hernia. And these hernias are not necessarily benign. They can actually become very complicated and actually lead to death. And it's important that we have a specialized team who do nothing but all this. They really focus on doing hernias to actually ensure that we don't have complications, we don't have recurrence, and we actually address the needs of our population.
Thank you again for having me as well. In Asian Hospital, we actually see about 120 cases of hernias annually from our previous census. Nationally, we don't have an aggregated census for the entire country, but basing it on the census of PGH alone, PGH is about 300 to 400 cases. So in the worldwide census, it is generally known that we see about 100 cases per 100,000 patients or individuals in the whole world. So converting that to Philippine numbers, somewhere around 14,000 cases, new cases annually. So that's a significant number. And we're only seeing about 0.2% of that volume. So even PG is only seeing about 2% volume. So if you have a dedicated center to address these kinds of problems, patients will know where to go to address these problems that they have.
Just for better understanding on this, how exactly will a specialized center improve per procedure economics?
Well, with the specialized center, you actually now have team of specialists who do nothing but this type of procedure. So the skill set dramatically improves. The team approach really results in a better outcome for patients and actually happier patients, right? You end up with results where specialized centers actually deliver better quality results for patients.
So since this center has been put up, it's a multidisciplinary team approach in managing patients with simple as well as complicated or complex abdominal wall surgeries. So because of that, materials that are unnecessary are eliminated, making it more economic for patients to undergo these kinds of surgeries. This can be translated for private patients as well as for HMO. So these are actually more efficient that way.
If successful, do you also plan to replicate this model in other specialties or locations?
Well, that's what we do as a hospital, right? We try to develop centers of excellence. And I think the Asian Institute of Surgery, with the hernia clinic in particular, this will be a really good model for other fields. We actually are looking at developing now our vein clinic because vascular surgery is an important problem now. Again, the very similar risk factors and between these two types of illnesses. So having a team approach, having specialized people who really do nothing but this, focusing on the patient, I think will really translate to better outcomes for the patient.
Yeah, totally agree because we're trying to develop their vascular access care center under the division of TCES. This is a center that we would like to cater to patients with those with AV grafts and IJs for those patients with dialysis. These are just part of the vein or the vascular entity that we'd like to get into as well. We're trying to move or shift our specialization from clinic-based to team-based so that there's more concerted effort in managing complex procedures. So even in hernia cases, we're not really looking just at inguinal hernias. We're looking at more complex abdominal wall hernias. The cases where we see lots of ventral hernias that there's a lot of loss of domain. So we were looking more at complex procedures that would be more of a help to patients needing more advanced treatments.
Thank you so much for sharing your thoughts, Dr. Beaver and Dr. Carlos. We are looking forward to seeing what's next from Asian Hospital.
Thank you.
Thank you.
Once again, those were Asian Hospital and Medical Center CEO and President Dr. Beaver Tomesis and Dr. Carlos Ejercito, head of the Asian Institute of Surgery. For more news, visit healthcareasiamagazine.com.